Hi there, this is Janice Rogers, and today I'm going to show you how to use the Member Payment Estimator tool on Aetna.com to help you make more informed healthcare decisions. When you go onto Aetna.com, the first thing you should do is click on these online tools, which give you links to short video tutorials on how to use the different tools on the Aetna website. I'm going to recommend that you look at the Member Payment Estimator tool at your convenience. This will give you a good introduction to how to use this tool so that you can compare healthcare costs at different facilities and at different physicians' offices before you seek treatment. Once you've looked at that video, you can head back to the home page and you'll notice that under this header Login to Aetna Navigator, you can get cost estimates. So click on that link now. This will bring you to the member login screen. If you haven't registered and set up an account yet on Aetna.com, please do so by clicking the Register Now button. It's an easy way to get through and it will give you the member login information that you need. Once you've gotten your username and password, you can log in on this screen. When you've logged in, you'll be brought to the Your Care, Your Costs screen, where you can click on the link to the Member Payment Estimator. When you get to this screen, you'll notice that in the yellow box at the top, your own personal information is showing: your name, your date of birth, and other family members as well who are on your plan. Next, you can select a type of service. I'm going to look at diagnostic tests and procedures, but as you can see, you could look at physician office services or other surgical or maternity procedures. Hit Continue. This will bring you to the list of diagnostic tests that are available for comparison purposes. I'm going to look at MRI. A lot of people are getting MRIs these days and they can be quite expensive, so it's a good one to be able to compare before you seek treatment. Now I can decide whether or not I want to get a list of hospitals and facilities near me that provide the service, or I can plug in the name of a hospital that I know that I want to use. I don't know where I want to seek treatment for this service, so I'm just going to say show me a list of hospitals or facilities near me. So click on Find a Facility. The Member Payment Estimator tool has provided you with a list of facilities in your area that provide these types of MRIs. So you can look at the list and determine where you want to seek treatment. Now, as I look at this list, I'm noticing that at most facilities, my cost is going to be nothing. And I want to know a little bit more about that. Why is that? So let's look at Mercy Hospital and click on Cost Details to get more information. Okay. The number to focus on is your Aetna member rate. This is the negotiated rate for this service at this facility for all Aetna members, all plan participants. And at Mercy Hospital, this particular service is $1,127. Now, the reason that it's telling me I won't owe anything for this procedure is because I happen to have enough money in my own HRA fund at this time to cover this cost. Now, if I didn't, if I only had $500 in my HRA, then my total estimated payment would be $627. Or if I was in the PPO plan and I had yet to meet my deductible, I'd have to pay my $400 deductible and then 20% coinsurance on the remaining amount, and I'd end up paying about $545 out of pocket. So I'm going to look at a couple other facilities, and I'm going to look at some non-hospital facilities because oftentimes they have better negotiated rates for our members. So let's look at Marshwood Imaging Center. And as you can see, the Aetna member rate is lower here. It's $1,016, so it's gone down a little bit. Let's check out another one. I'm going to look at Insight Premier Health. Okay, and as you can see, at this particular facility, the cost of an MRI is only $600. So that's going to be a significant amount of money less coming out of my health fund or that I might have to pay out of pocket. Now, the nice thing about this tool is that you can print out these cost estimates, bring them to your doctor, and ask your doctor about the quality of care at each of these facilities. Obviously, you want to go seek treatment at a facility that has good quality of care. But all things being equal with that, you might seriously want to consider the facility that has the lowest cost so that you're paying less out of pocket for the same service. This is all real-time information, so as you have claims go through the system, the cost estimator can change. It depends on what's already been processed and paid through your account. But this is a really handy tool to use when you know you're going to be seeking health care treatment that might be significantly costly and that you want to compare and contrast before you go. If you have any questions about the member payment estimator or any other questions about the healthcare plan or Aetna.com, please feel free to contact somebody in the HR department, and have a great day. Thanks.